Hello, I'm Dr. Theodore Henderson with the Synaptic Space and the Neural Laser Foundation.
Hello, I'm Dr. Larry Maurice with the Neural Laser Foundation. Along with our colleague, Dr. Paulo Casano of Mass General, we present a review of the treatments for traumatic brain injury, and in particular focus on the revolutionary new treatment using infrared light. In this review, we focus on current treatment and their efficacy. We also discuss the mechanism believed to underlie near-infrared phototherapy. We're presenting an exciting new treatment for traumatic brain injury and illustrate the efficacy of this treatment with a case series of patients.
Traumatic brain injury, or TBI, affects many individuals among the civilian and military population. Research has shown that returning military personnel have a relatively high incidence of TBI. In fact, estimates are that 9.6 to 20% of veterans have TBI. Among civilians, approximately 2.5 million cases of TBI occur annually, largely due to motor vehicle accidents and sports-related injuries. The majority of these injuries are mild TBIs, also referred to as concussions. However, it is a mistake to assume that mild TBI are benign and yield no significant lasting sequelae. In fact, many patients with mild TBI experience lasting symptoms including headache, visual disturbance, cognitive impairment, loss of executive skills, impulsivity, impaired judgment, emotional outbursts, relationship difficulties, memory impairment, dizziness, fatigue, anxiety, and depression. The Veterans Administration acknowledges that often the diagnosis of TBI can be missed in patients who have both TBI and PTSD because of the significant overlap of symptoms. Over 400,000 military personnel and veterans have been diagnosed with PTSD or TBI since 2001, and many have been diagnosed with both.
Near-infrared light phototherapy has been studied for over 30 years in laboratory studies, animal studies, and human clinical trials. Current data indicates that near-infrared wavelengths of between 600 and 1,000 nanometers are absorbed by the cytochrome C oxidase in the mitochondria. This increases ATP and activates secondary molecular and cellular events. Early response genes are activated and the expression of numerous genes is altered. In fact, research shows that there is increased transcription of over 100 genes, in particular cell survival genes, neural differentiation factors are transcribed, synapse formation is increased, and growth factors are activated.
In a companion paper, we detail the factors regulating the penetration of near-infrared light through skin, bone, tissue, and brain. Our studies have shown that low-power infrared light in the milliwatt range does not penetrate a full-thickness section of human skin. We've also found that low-power devices do not deliver any significant infrared energy to a depth of 3 centimeters into the brain. These findings in our lab and other laboratories support the use of higher-powered infrared light sources.
We have used infrared lasers in the power range of 10 to 15 watts to treat patients with traumatic brain injury. In a series of 10 patients with traumatic brain injuries, all in the mild to moderate categories, and duration since injury ranging from months to 10 years. We have found clinical improvement in all cases. 40% were male and 30% had obtained their head injury in the military service. Let's hear about their symptoms. Some patients were depressed and suicidal. The mean QIDS, Quick Inventory of Depression Symptomatology score, was 25.3. After a series of 10 to 20 near-infrared light therapy treatments over the course of 8 to 10 weeks, the patients all had complete resolution of sleep disturbances, improved headaches, improved depression symptoms, with no suicidal ideation. The QIDS score fell to 2.2. Most patients had less anxiety, much less irritability, and their marital relationships had improved.
That your
You're able to move easier, or use your hands easier, or talk easier?
Yes, especially my speech. I've noticed really my speech has gotten a lot more fluid.
It didn't happen overnight. It was multiple treatments, but you notice a difference. You notice you could sleep better at night. I was calmer. I wasn't as angry as often. I wasn't as just spastic as I used to be. I could sit down and concentrate.
The change in symptoms and function has not been transient. The duration since treatment ranges from 12 to 48 months.
It's given me a new life or a new opportunity to, after 30 years of stagnating.
Yeah, I'm still seeing the benefit.
After how long?
A year. I'm still seeing the benefit after a year.
To date, there has been little progress in developing effective treatments for chronic mild to moderate TBI or repetitive concussions. Near-infrared phototherapy has shown promise as a tool for the treatment of TBI. A critical issue is to assure that adequate photonic energy reaches the injured areas of the brain. The use of high wattage lasers, as we have demonstrated, results in marked clinical improvement in patients with chronic TBI. Moreover, symptoms consistent with PTSD, anxiety, and/or depression also improved considerably or resolved in this group of patients. Further work in the use of complex multi-watt near-infrared laser therapy in the treatment of TBI, depression, PTSD, anxiety, and other neurological disorders is encouraged.